Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about upper eyelid surgery. Will losing weight influence the results of upper blepharoplasty? And in answering this question, I'll talk about the anatomy of the eyelid and where fat in the eyelid is relevant to this question. And we'll talk about measures that you can take to ensure that you have the best possible result from upper blepharoplasty. My name is Dr. Julian De Silva and I'm a London-based facial, cosmetic and plastic surgeon, and blepharoplasty is the commonest procedure that I complete for patients, and I help patients with this every day. So does losing weight influence the results of upper blepharoplasty? Well, in essence, no, it doesn't. It doesn't really affect the upper eyelid, and although there is fat in the upper eyelid, this fat is relatively unique and is different to fat elsewhere in the face, and really losing weight will not make a significant difference to the appearance of the upper eyelid. It can affect your face in general, and losing weight can influence more the features of your face and the lower eyelid, where losing fat will be more clear. However, it won't directly influence the upper eyelid. And the reason why is when we look at the anatomy of the upper eyelid, well, there is often a bulge in the inner corner of the upper eyelid, and this is due to orbital fat that is coming forwards, and this orbital fat protects your eye when you're walking and running and all these kind of activities. But partly genetics, partly aging, some of this fat can creep forwards, and as it does this, it can create an unnatural bulge in the upper eyelid and a more tired appearance. And certainly in upper blepharoplasty, your surgeon will shape that underlying fat, refine it in order to ensure that this area is smoother after the surgery. However, this orbital fat is relatively unchanged by losing weight, and so losing a large amount of weight is unlikely to influence this. What are the factors that can influence upper blepharoplasty? Well, it's worth mentioning some of these, as these will improve the results of your surgery. Firstly, smoking. Well, smoking influences healing and the recovery after surgery, so I would advise all my patients to avoid smoking for a period of 6 weeks before and after surgery to ensure that you have the best possible result and fastest healing. In addition to that, avoiding thinning agents that thin your blood. And the agents that thin the blood can be herbal medicines, and I give all my patients a long list of herbal and non-herbal medicines that are best avoided before surgery, and these can include things like fish oil, St. John's worts, and other kinds of vitamins, and it's important to avoid these in order to get the fastest possible healing after surgery. In addition to this, if you have any other medical conditions, and notable ones are blood pressure and diabetes, it's very important that these medical conditions are well controlled before having eyelid surgery to ensure that you have the least possible swelling, least possible bruising, and fastest healing. And things like your sugar control and blood pressure can have a direct influence on how the body heals after surgery, and in order to heal the fastest, it's best to control these in advance of having eyelid surgery. And finally, it's worth mentioning the surgical technique that is used to complete your upper blepharoplasty, as different ways of conducting the surgery will influence healing and the final result. And I tend to use more advanced techniques such as platelet-rich plasma and growth factors that will tend to enhance recovery and healing. However, there are different ways of doing the surgery, and surgical techniques such as hiding the scars in the natural crease of the eyelid will tend to give you a faster recovery and potentially a better result. So in summary, we've talked about the impact of losing weight on upper eyelid surgery. We've talked about the facts that the orbital fat that creates these changes is really indirectly relevant to losing weight, and hence losing weight will not have a significant effect on the final result. But then we've also talked about measures that you can take in order to give yourself the best possible result. I hope this information has been useful for you. Thank you for watching.